Right. Now, before we start, I want to ask, any of you suffer from back pain? I mean, lower back pain. If you do suffer from lower back pain, there's a chat box that you can type yes.
Yes.
Yes. Okay, Bobby. Okay, cool. Any others? Just one? Okay, Glenda. Okay.
Oh,
Thank you. Okay, thank you. I see that three respond. Okay. I'm not quite sure the others, but we have about 6 people, including me, online. Okay, that's good. Now, let me share the right. Can you see the screen, the PowerPoint presentation? If you can, please type 1.
yes, I can.
Oh, good. Thank you. Okay. Then I assume that the rest of it will, will see it clearly too. Okay, cool. Now, whoop, what am I doing? Okay, cool. Okay. Today's topic is discover acupressure point to relieve lower back pain. So that's something that you can do at home. Okay? Now, how do I go to the next? Yep. Okay. Now, have you ever seen people like this? I mean, they're standing up, and then one shoulder is higher than the others. If yes, please type 1, just 1, rather just
Yes, yes.
yes. Okay, you've seen this. Okay, what does it mean? Pretty obvious. Okay, this means that there's a structure imbalance. We call structure imbalance. So, in this image on the left, left shoulder is the higher. Okay. Then what happened is in the inside on the right image, you can see the bone, you know, all this bone structure. And you can see that one shoulder is higher than the others. And this is the back, from the back, we're watching from the back, okay, on the right image, okay. So you see that the left side is higher, the right side is lower. So what happened on the pelvic bone in here? Right side is higher, left side is lower. And then on the spine, you see there's a curve, the scoliosis. Right? So if you have one shoulder is higher than the other, you will have a bit of scoliosis. Most of the case. Some cases not one shoulder higher than the other is not causing by the scoliosis. Okay, you will have a little bit of scoliosis, depending how bad is it. Okay, then how do we know? We have to check it out to be to understand it. So as you can see that it put pressure on the spine as well. Not just the not on the just the lumbar, on the others as well. Okay, I'll show you more. Okay, the next one. So the structure imbalance, as you can see here, this one is healthy one, and over here scoliosis, but that one's only happened on the thoracics. What's thoracics? Thoracics mean the chest area, your upper back area. Okay, and that one is thoracic and spine, part of the lumbar and the thoracic. So which means between your upper back halfway to your lumbar. Lumbar is lower back pain, okay? Lower back. This is a lower back as well. This is just lower back, right? And just lumbar area. And that one is combined, thoracic and lower lumbar. The lumbar. See, okay? All right. The next one. Now, you see in the left side, this is a normal one. As you can see, the spine pretty straight and both shoulder even. and the pelvis even, and look at the hip joint, both even, knee joint even. Okay, but what happened to this one on the left? You can see that shoulder, one shoulder is higher than the others, left side, and left hip or pelvis here is higher than the right. And you see that this is the hip bone, one side is higher than the others, and surely over here, knee higher than the other. So one leg is actually higher, means shorter. That one's higher, means left side is shorter than right side. So with this person, and they standing, and you see some person, they like to stand on one leg. It's not their fault, all right? That's because the spine's uneven and the foot's uneven. So by looking at how people standing, and we know what's going on inside. Okay. Now, as you can see here, the weight, okay, the weight is actually put on both legs. So the whole weight is on the spine down, go evenly to both legs. But that one is actually going to spine down because the spine is curved, and it can't go to two legs, it goes to just one leg. Okay, so there's pressure over here, pressure over here, pressure on the lumbar. So it could, so this man may feel pain in the lumbar area, which is lower back pain. It could feel pain on the neck, could feel pain on the knee or ankle or hip, one or the other. It doesn't mean that you have this uneven shoulder, you going to pain all over your body. In some cases, yes, but in some patients, they just very localized. The pain may just happen in lower back or just neck. Okay, and today we focus on lower back. Now, we're talking about structure imbalance, right? So what is structure in the lower back? What are we talking about? First, we're talking about muscles. This muscle guy, right? We pull out the skin, you see the muscle over here. And we pull out all the muscle, we can see bone, and we can see a bit of muscle in between the bone, okay? And we pull out the muscles, what happened? This is ligament, tendon. So I will, in this page, we're looking at muscles and ligament. Those two things, or tendons, they are what we're talking about now, structure, part of the structure, okay? And what else? What else? This is a lumbar spine, which is over this area, muscle guy over this area, okay? Now, what we're looking at, we're looking at bone. What is bone? This is bone. This is bone. L2, L4, L5 is bone. All this is bone. Between bone, we call joint, okay? We call it joint. And then what happened on the spine, and between the joint, there is a disc. So this white stuff called disc. So you heard about right? Disc protrusion, okay? Herniation disc. That means that this over here pop out to the back. This is the back, this is the front. Okay, so this is the front, this is the back, right? Front, back. This is the front, this is the back. If this pop out to the front, you would not, because there is no nerve. There's no nerve. Where's nerve? Nerve is the yellow part over here. Those are the nerve. So if any of the discs pop out and punch a nerve, then you will have radiation pain or numbness, pins and needles to your leg, or even to your toes, or to your thigh, or just in your lumbar area with pain. Okay, right. In this page, we're learning here bone, nerve, joint, disc. They are all part of structure. Okay. Now, what we talk, looking at this one, okay, look at here. You see, we have heart over here. This is the right side, okay? Heart over here, lungs over here, liver, large intestine, small intestine, stomach over here, spleen over here, okay? Now, if someone have an uneven shoulder, what happened to the organs? Does it actually affect the organ? Yes. How does it affect? Okay, look. If this organ is all in here, right? You see that the spine go pressing to here. What does it press on? The right lung. Okay. And you see that the pelvic on here. This is ribs. Between ribs in here and here, this is less space, and this is so it's squashed over here this side. You see over the side squashed over here. So the organs over here will have less space. So you need to, if someone hold your arm, what do? If someone catch you, just hold it very tight. You want to work very hard against them. That is why when we take the pulse, we find that some organs overactive. It could cause form uneven spine. The pressing on the organs and make the organs actually work harder and put pressure on the organ. Okay, that could be one of the reasons. Now, so we know the structure imbalance affect the organs, and organs function. The organs function may off due to the structure imbalance. Okay. Now, this is just talking about if you see someone with uneven shoulder, and they may have organs issue. Okay. And I'm going to show you how do you figure out the organs problem. And in Chinese medicine, we do acupuncture, and acupuncture is based on meridian theory. So what is meridian theory? Look at this little man over here, the model. You can see a line going through that body, up and down, with different color. If we see on this here, the left side is human body meridians. So the different color from top down here, green, yellow, and some go to the hands, blue one, orange, red. They all represent different meridian. For example, this one called lung meridian. We go to the lung, so we call it lung meridian. For example, this one called pericardium meridian. Pericardium is a tissue that around your heart of pericardium. And that is heart meridian. Heart directly connect to the heart. Okay. Over here. Oops. Sorry. Now, this is from the back, the right image. Yeah. So this is the lower back. In the middle, we call Du meridian. Du meridian control all the young energy. Okay, so some pain may be in the middle. That's Du meridian problem, which is in the middle of the spine problem. Over here, that line and that line we call bladder meridian, because those two meridians directly go into the body, connect to the bladder. So bladder meridian is from head going down to your neck, and then separate from 1 to 2 meridian, going down and down to your back of your leg, and back of your leg, and go to your little toes. So some patient, they feel pain in here and also feel pain on the back. If the pain is just in the back of your thigh and lower leg, they are all related to bladder meridians. Okay. Now, this is when we do acupuncture, we do acupressure, we're based on meridian theory. So all acupuncture point or acupressure point are on meridian. Okay. Now, further on, I'm going to show you what the relation between the organs and the structure. Okay. Before I go ahead, go further, do you guys have any question so far? Sally, I can't hear you.
What caused sciatica?
What causes sciatica?
Yeah.
Sciatica. Okay, good point. Let me.
Which part is the nerve affected?
Which part? Let me show you. So sciatic nerve.
Okay.
It can come. It could be sciatic nerve is the longest nerve in the body.
Yeah.
It come out from those L1, 2, 3, 4, 5, and they combine together. Let me find another one. And they come up from here and combine together. It has a very silly thing. It actually goes through one of the muscle. So none of the sciatic nerve is very silly nerve. Okay, none of the nerve go through the muscle. They all go around the muscle and between the muscle. Okay, and but sciatic nerve actually go to peripheral muscle. Just this is a whole muscle, but it goes through inside and from here go into it, and then go out from the other side. That muscle is actually in your buttock. So if this muscle tight, spasm, and I punch the sciatic nerve, and you get pain here down to your leg. That's one cause of the sciatic nerve. So another sciatic problem is from the spine, which is I show you over here. We said hernia this, all right? If the disc pop out, punch the nerve, either of them, and then it will go, pain will go from here, down. So it can go down here, it could go down to the side, right? So that is an anatomy view that we saw this. But in the Chinese medicine, when the pain going down here, and we know is bladder meridian. If the pain going down here is gallbladder meridian, then we need to treat the meridian as well as the organs. So one thing that I'm going to show you right now, is it good, Sally?
Yeah.
That makes sense? Okay, cool.
Yeah.
Now, the next thing is going to be very interesting because we're going to talk about the organs.
Okay.
Okay. So all you can see here, this all meridian, right? You can see meridian. And we say that this is bladder meridian. Over here is gallbladder meridian, heart meridian, kidney meridian, all this meridian. They all connect to one of the organs, all the meridian here. That's why we call it bladder meridian, large intestine meridian, heart meridian, stomach meridian, all sorts, okay? So what is in the meridian during the Chinese medicine? They qi, which is energy, and blood, okay, flow in the meridian. And the reason that you get pain and you suffer from pain, that is because there is a blockage in the meridian.
Oh, okay.
What causes pain. Okay.
Okay, good.
So
Yeah.
do not get the idea that when I say that, oh, blood's in the meridian, and then you say, oh, that must be the artery or veins. No, it's different idea.
No, different.
Totally different idea. So meridian, you open it up, you can't see it. You can't see it. But if the energy is flowing and the blood's flowing in there, so the blood, rather the blood that you is in the idea that you can see is an invisible blood, right? The real blood. Okay, so there's energy type blood. Okay. Now, so the question is, where are all the energy and blood come from?
What?
So the energies and the blood, where are they come from? So there is the energy and blood flow in the meridian, right? So all
Fine.
the blood and energy are based on the organ function. If the organs function are good, and they can supply more circulation to the meridian.
Okay, I understand now. Okay, got it.
So when there is pain, according to Chinese medicine, it's a blockage. So there's two ways causing the pain in medicine, right? The theory is if there is blockage, you will suffer pain. And then what we do is unblock the meridian. Then once you unblock the meridian, the blood flow goes through here, you won't feel pain. But there is another thing that is important, and a lot of people miss that, because unblock the meridian, a lot of things you can do. You can do massage, you can do acupressure point, and you can do exercise. But once we understand that if you want to unblock the meridian, you need to have enough blood, a good source of blood and energy. Then that means that you need to have a good, very good functionality in the organs. Does it make sense?
Yes.
If your organs are not function properly, then it can't supply enough blood. It
To the
can't
meridian.
supply enough energy to push through the meridian.
Yeah.
And when the blood slows down, it will naturally just stop and block over there, and the pain.
Okay, now I understand.
So it's easy to treat a patient when their organs are good and they have an injury, and the injury actually caused the blockage. The blockage is actually in the meridian. So we simply just unblock the blockage.
Okay.
Then the organ will supply all the blood and energy to the meridian, and then pain stay away. But most of the cases in our clinic, we can see that they have chronic back pain, and they have diarrhea, and they have cold hands and feet. All this bad circulation, diarrhea, bloating, insomnia, that indicate organs imbalance. So with the pain that they suffer from, they will get results, but once the pain relief, with the acupuncture, after a few days, the pain came back again. That's because the organs is not good enough to supply all the blood and energy that meridian need. Does it make sense?
Yes.
Okay.
I
Cool.
understand.
So with the scar tissue, Sally, you understand that scar tissue, because it unlocked the blockage in the spine.
Yeah.
So one other thing that, some people have operation surgery in the back or in the tummy, right? And when the scar tissue heal, it actually unblock meridian, and therefore we have a different skill that we we provide, and then the other clinic don't do that, because we figured out ourselves that using acupuncture needle to relieve the scar tissue and therefore to relieve back pain. Okay. Anyway, let's keep going and focus on here, because after this, I'm going to show you the acupressure point for your lower back pain.
Okay.
Be able to get instant relief from the technique. Right, over here. Now, this is going to be a quick review. Now, in this chart, you can see that this is the organ. And again, this is according to Chinese medicine, okay? Heart and small intestine, they are twin sister. Because they all belong, both of them belong to fire, one of the five elements, five elements, okay? Spleen and stomach belong to earth. So earth is one of the five. And lungs and colon, which is large intestine, belong to metal, right?
Oh.
Kidney and bladder belong to water. And liver and gallbladder belong to meat. Okay, so this is 5 elements. So we have 5 different pairs of organs. Now, look at, we're gonna keep it simple, okay, here. Spleen and stomach, both of them control muscle strength.
Okay.
You see, what's muscle? One of the structure in the lower back. So they both of them control the entire body's muscles, not just one piece of muscle. So all the muscle strength come from stomach and spleen function. If stomach and spleen function good, then the entire body have the strength. The muscle is going to have the strength, very well strength. And then if you suffer from digestive problem, so what kind of symptom would it be? Let's go to here. Now, if stomach and spleen are out of balance, you may have sore, tight, or weak muscles, and shoulder pain, bloating. So bloating is very obvious digestive disorder condition. Pain in the stomach, acid reflux, passing a lot, burping, diarrhea, or constipation. They all indicate that the stomach and spleen are out of balance. So for this patient, if we're treating you, if you have all this symptom, you come for back pain, we not just want to treat the symptom, we want to bring up the stomach and spleen function. Why is that? And then we reduce the bloating, pain in the stomach, acid reflux. If you diarrhea, we want to get the diarrhea stop or reduce that, because all the symptom reduce, it's going to help the muscles. It's going to help the treatment, speed up the treatment. So if we give you some treatment and you get relief, if the pain, lower back pain, muscles weak, the relief may only last for 1 or 2 hours, or just 4 hours or 8 hours. It may not last for 24 hours, or 48 hours. Okay, so the idea is one acupuncture, some people get relief for a week, some for 2 days, some for 1 day, and we couldn't tell how long it's going to last. The results, how long the results going to last. It's all depend on your organ situation. Does it make sense?
Yes.
Okay, cool. Further on, this is those 2 organs control muscle, right? What else we learned before? We talk about bone. Okay, kidney control bone.
Oh,
Kidney control bone strength. Also, kidney control brain function and urine and reproductive system. Let's go further on. Now, because kidney position is in the lower back. If kidney organs not well, directly you get achy over here, especially when you're standing and you feel tired in the lower back and you feel pain. And then with that, and then you go have night urine, get a lot of time, or two or three times urine, or you can't control your urine properly. You have urgency to go to urine, or very frequent during the day, or even you go to toilet for urine and then you finish and say, oh, I'm not emptying properly, I have to go back. And that all indicate kidney and bladder issues. And when you have those issues, the bone will not have the strength that it should be. It should have. Does it make sense? Okay, this is how we look at it, find out the internal organs issues, and then how they link to your lower back. We want your organs to get better, rather than just if it's an acupuncture or acupressure point, we leave the lower back. Okay, and more because kidney control the brain functioning, so a lot of headache, dizziness, memory problem. We talk about the night urine disorder already.
Oh.
A lot of infertility problem or menstrual disorders. Ringing sound in the ear. Well, ringing sound in the ear. A lot of people have this.
Yeah.
Or the hearing is starting to not being very well. All right. Can't hear properly because in Chinese medicine, kidney control ear. Okay, so we have this ear problem, then again that indicate the kidney is not very well. That also indicate that the bone strength not as good as it should be. Now we come to liver and gallbladder, twin sister again. Control detoxification. They also, in the structural part, they control tendons, joints, nerve function. Quite important one.
Yeah.
Also, I didn't list it here, which is ligament. It's actually controlled by the liver as well.
Oh gosh.
They control the eyes. And if what's internal disease, how do we know that the liver is not doing well? Red palm, red or sore eyes, no strength in limbs, shaky hands like Parkinson's, shaky legs, joint pain or stiffness, any nerve pain. Okay, now, so those are the organs function we call physical function that we just point out. Okay, and those three pair of organs, spleen, stomach, kidney, bladder, liver, and gallbladder, okay, they connect to muscle strength, bone strength, and tendon, joint, and nerve functioning. Okay, and apart from that, how do I didn't put on here. Okay, apart from that, there's emotional energy as well. Liver and gallbladder, if they're out of balance, so you may get stressed easily, impatient, frustrated, irritability, all this emotional dysfunction. And kidney out of balance, you get fear, like scare. Something just dropped and then you, oh, what's going on? You know, scared all the time. Spleen and stomach out of balance, anxiety, worry a lot. So that is the emotional energy side. So the emotional energy side, this is only based in Chinese medicine. Again, if you talk to your doctor, they wouldn't understand that, okay? Because it doesn't relate in the medicine. All right. Now, what we're talking about here, the reason I want you to understand a bit of theory in there related to the lower back is because in the acupressure point that I'm going to show you later on, it's actually just enough to do the job for body meridian mending. Okay? Mending. Does it do for organs? Yes, it does too. But does it do for structure imbalance? No. Okay. Now let's go through this one first. What do we need to deal with lower back pain? Okay. In Chinese medicine, we look at body meridian blockage. Right. If you're out of balance, you have, one shoulder higher than the other, or you have lower back pain that causes lower back pain, or your shoulder pretty even, but you still have lower back pain. Definitely you have a body meridian blockage on the lumbar area. So our idea is unblock the meridian. And we have a method called balance method acupuncture. Very good for unblock the meridian. And there's two ways we can go through. The point selection. We go to a local point. You can get massage, do some acupressure point in the back area. Good method. Right. Then in acupuncture point selection, we call this as local point selection. We have another strategy called distal points strategy, which means we're going to choose some point on the hand, head, or leg, because all the points connect to the meridian, and it can help the area over here to unblock the meridian. So which means I'm choosing some point over here, pressure over here, and you feel relief on the lower back. So this is called distal point strategy. Now today, I'm going to show you some point on your hand to relieve your lower back. Okay, we're going to do some tests, very quick one. Okay, I'll come with that one. Okay, structure imbalance. Now, with structure imbalance or uneven, we're going to balance the structure, of course, right? And we use another type of acupuncture technique we call GE structural acupuncture. With organs functional imbalance, of course, we need to rebalance the organs. And we use another type called post-organ functional acupuncture. So we have 3 types of acupuncture to deal with lower back pain. Of course, we need a proper diagnosis to be able to find out which acupuncture method suit your back pain, can treat your back pain. Does it make sense?
Yes.
Okay, thank you. Now, this is another structure imbalance that I want to show you. If you lay down and you put your legs, and make sure that, hang on, when you lay down, make sure that you don't have anything on your back pocket. Okay, and you want to lay down to not too soft surface, a bit harder. Your bed, if it's too soft, it's not good. It's not going to be accurate. Okay, and then put your legs over there, relax, and then you pull your head and look at your leg. If you see one leg is pointing to the others, and this one, Right leg is pointing outward to the right, and left leg is pointing to the right as well, which means you can see that's one of the uneven leg. So we talk about one leg is shorter than the other, it causes back pain. And this type of structure imbalance, it also causes back pain. Not just back pain, it could be others as well. So we call yin-yang imbalance. It is a term that we call yin-yang imbalance in Chinese medicine. Okay, I'm going to show you more. So over here, if the right side is toward to the right side, we call right leg is yang foot. The left foot pointing to the right side, right, is over here. And then we call this is yang foot and this is yin foot, right? You see, the right image is the opposite. So that leg's going that way, that leg's going that way, right?
Yeah.
So left foot toward to the left, we call left foot yang. Right foot toward to the left, we call right foot yin. This is how we figure out yin and yang. This is a type of diagnosis. By observation, we'll be able to tell. Once we look at the legs like this, we know what's happened in the upward. We know which point we can choose to treat. Okay, but I'm not. I can't actually show you the point in here. This is the structure one, and it's best for acupuncture to deal with it. So this is some case that student that in China they did the case. Okay, so this is they have spinal problem, and you can see that this is before, this is after, this is before, this is after through acupuncture. Okay, and the scoliosis, very bad one. This is before, and this is after. Okay, I'm not going to go through that one. Oops, sorry. All right, here you go. This is the point for tonight. Then I'm going to show you.
Okay.
Right. Now, everyone, you have back pain, right? Somebody said you have back pain. Now, can you feel the pain right now in whatever your position is now?
I got no pain at home.
You have no pain. What about, can you, because I wonder if you can feel the pain right now, and I want you to ask yourself, out of 10, how would the pain be, pain level? From 0 to 10, 10 is the worst, 0 is no pain at all. Can you rate your pain? If you don't,
0.
pardon?
0 at the
Okay,
moment.
Okay, good. It's good. Now, if you have 0 pain, no pain at the moment, then you want to stand up and bend forward or to the side or backwards, to find whether it is tightness or pain. You have to stand up and do some, because what I'm going to show you, you're going to find a point, and I want to test the point, massage it, and then you're going to stand up and do the movement. If you go to, let's say, if you bend to your right side, left side, and you feel pain in your, could be left side, could be right side, and then you ask yourself, how bad is the pain out of 10? If it's 5 out of 10, then what you're going to do right now, later on, I'm going to show you where exactly the point is, and you're going to massage it. And after the massage, and you stand up again, and you bend to the side again. And then you feel, oh, the pain was 5 out of 10, and now the pain down to 2 out of 10. That means you're doing it right. That means the distal point is working for you. That's why I want you to, if you haven't stand up and just move around and find the pain. Can you feel the pain? So any of you can feel the pain right now? Backwards, forward, sideways, or just turn like you're driving and then you turn to the back and look at something, twist your back like this. If you can feel pain, you let me know. So we're talking about the pain actually on this area. Eh? Some of it may be in the this area and your buttock, and that's okay too. Just let me know, because the point I've shown you mainly for this area. If you pain down the other area, you let me know too, because I can show you the other acupressure point to help with that.
My pain. Yeah.
Okay.
Who go first?
Sarah, you go first then.
Okay.
Now,
when I turn to the left,
yeah.
So just go to the left side. My pain is on the left side itself.
Yeah.
At the lower back.
Over left, over the side.
On the left.
On the left.
So instead on the right, the pain was because my spine go to the left.
Yeah.
So that's where the pain. So I would say around 6.
6. Okay. Okay. It's in here, not up here, not down here.
No. Yeah.
Okay, good. That will work. Okay. Thank you. Thank you for sharing. Glenda.
My pain is on the right, about 5.
5. Do you have to do any movement to feel the pain?
Maybe 3 when I'm not moving.
Okay, cool. Okay, you remember what the movement is, and after the point, and then you're gonna test it yourself again. Okay, right. John, do you have any pain? We can't hear you. Right? Or Bobby?
Yeah.
Yeah, John.
This is Kevin here. No,
Kevin,
I haven't.
Sorry.
Yeah, you're right.
It's all right. There's 2 of us.
There's 3 of us actually.
Okay, good. Hi, Kevin.
Yeah.
I can't see you, so I don't know. I can see your name, Bobby, so I keep saying Bobby.
Yeah, no.
There's 2 of us.
Hello. Good to see you.
3. So, no, my pain is gone. Kenny fixed it.
Oh, good. Thank you. That's awesome.
Yes, actually.
Yeah, I'm 100% now.
Oh, cool. Good to know. Yeah,
Mm.
I haven't heard from you, and Kenny didn't tell me that. So I didn't know. That's great. That's great. That's great. Thank you. So happy for that.
I'll put the screen on, maybe.
John, do you want to share?
It's all right. Put it on.
John, we can't hear you actually. We can't actually hear you, John. No, we still can't hear you. That's okay, John. As long as you know where your pain is, what movement that causing the pain, and then you write down out of 10 how bad is this before the acupressure point. So John has actually been having a lot of acupressure point himself, and he find a lot of acupressure by helping him. So distantly actually prescribe herbs and send it to John in Australia, and he just follow my YouTube video or short TikTok video and do all the acupressure point. Okay, right now, what we're gonna do, I'm going to share the presentation. This one. Okay, over here. This is in the left image. The left image, okay, it's showing left hand, all right?
Yeah.
So you see, this is called metacarpal bone. This is called the 5th metacarpal bone, and come down to the bottom over here. So closer to your wrist, okay, over here, you're going to find some point, sensitive, and you can use your knuckle or you can use your thumb. If you have a long nail, please don't use that thumb. Use a knuckle will be better. A bit hard to control with knuckle, a bit easier to control with the tip of the thumb, right? You find more stable, and here a lot of time you lose it, yeah, like that, but it's still okay. Press it in here and rub it. Can you find any pain, sore spot? That is one of the back pain spot. That one can help back pain over here on the side, as well as in the middle. Right.
Yeah.
If you find this point is difficult to locate, I'm back to here. Thumb, sorry, I should, okay, if you find that one's difficult to locate, come back to here. Thumb coming down to your hand of this area, palm area, this is called the first metacarpal bone. Index fingers come down to here, this is second metacarpal bone. Right? So between those two bones, the first and second metacarpal bones, going down here, you can see that they join together. Okay, before the joint, you put your finger in between this joint, but move toward to the second metacarpal bone, just next to the bone. Can you find any sensitive point over here?
Yeah, that's
Okay, now most of you may do it that way, but I would suggest you use your thumb that way. So your four fingers holding the fifth metacarpal bone here, your little fingers over here, and use your thumb and pressing over here. And you want to press the pressure rather than go deep that way. You move toward to the second metacarpal bone, and you find it more sensitive. Right, this is very good for back pain. If you find it, press and rub it. Yep. That way, Sally, that way. Hold your four fingers over here. So you find it easier, more string. Okay.
so.
Now, if you have arthritis in your joints, I won't suggest you do it. You need a tool like this. You really need a tool like this, okay? It's available in our clinic. This one is pretty good. So we have 3, 1, 2, 3, and that one you can do guasa. So you should do this rather than using your knuckle or your thumb, because once you do all this point, you're going to have a lot of pain in your fingers. It's not worth it, okay? So get one of this and find a point and press it for 30 seconds. Press and rub, press and rub. You need to put a bit of pressure there. You can feel the tenderness spot and hold the same pressure, same level of pressure, and just rub it. Remember, toward to the bone and just rub it for about 30 seconds.
So how often should you do it?
How often? Do it all once and you can repeat. You feel you need to do 30 seconds first and you do all and you test it out. If it works for you, then you can do 3 times daily whenever you feel the pain, extra one. And when the pain subsides, you don't feel it as much as often, then you can do less. But is the pain still there? And you can just do once a day. And your aim is to remove all the tenderness spot over here. Now I'm only showing you 2 points at the moment. There are a few other points. All right, you get it?
So the 2 points are here and here.
One and here. Okay, there are more. Coming. It's coming. Okay, here you go. So that is what we're talking about just now.
Yeah.
So look at the structure, only the bone structure.
Yeah.
Again, this is left hand.
Yeah.
This is left hand.
Yeah.
Metacarpal bone over here. There's 1 point over here.
Yeah.
And go across to the point at between second and third metacarpal bone. And there's 1 point between third and fourth metacarpal bone. and the other point between the fourth and fifth metacarpal bone.
Yeah.
Exactly that I show you on here. So those points, rub it for 30 seconds each point. Do it now, and then test out how is your back pain after those points. All right, let's do it all together. Now, we're gonna shorten a bit, not 30 seconds, just do 10 seconds in each point, okay? 10 seconds in each point, right? Let's start. Number one, between first and second metacarpal bones, you find a point, you rub it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Move to the next one. You must find the sensitive point. If you don't find the sensitive point, you go up a bit, a lower a bit, and keep going. 4, 5, 6, 7, 8, 9, 10. Move to the next one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The next one again. 1. Oh, this one's so painful. My one. 2, 3, 4, 5, 6, 7, 8, 9, 10. The last one over here. This is harder. You have to dig a bit deeper and closer to the bone. You'll find a painful spot. If you can't, just keep moving up or down until you reach the spot. You must find the spot. If you don't find the tender spot, it won't work at all. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's it. Now you should stand up and try it. If you sit there, you were feeling the pain. Now you sit there and think about where is the pain, and then stand up and move to the area and see whether the pain has decreased or not.
Yeah. It's gone down. It's
It
gone
was
down.
6. What is it now?
I'll say around 1 or 2.
Oh, that's very good.
Yeah. I did that just now standing up. I don't feel anything. Not so much pain as earlier.
That's awesome.
So I can do that the same thing for the right side too.
Yes. Either side.
Okay.
So
yeah.
I want to share with you that with what we call this 5 back pains, back 5 points. Back 5 points. They work very well for back pain. And you find it similar on the other side. You have some pain over here, but do test it out, because one hand will work better than the others. And if you ask me which one work better, I really can't tell you. Some patients find this hand, some patients find it, some patients are, oh, it doesn't matter. Both hands work very well. So therefore, if you rub it over here and it helps, and you have like from 6 down to 4, and you can change that hand and rub on this hand and see whether it can bring it further. That's number 1. Number 2, if you run it over 30 seconds or 10 seconds that we just did, and you feel it decrease the pain, you can increase 1 more sessions. And if further take away the pain even lower, increase another session. Okay? That's simple. Right.
I can report that my pain is a lot less too.
Awesome, Glenda.
Hmm.
You guys are so smart. Awesome. You all get it. I'm so glad.
Thank you.
You're a fast learner.
No problem at all. Happy to share.
Yeah.
Happy to share. Okay. So all this thing, you can do it. Like what I suggest is, if the pain is quite consistent in your lower back and the level is pretty high, and always test it out. If it doesn't work, which means this distal point doesn't work, and you may need local points. Or it could be because you have a structural problem, so it doesn't work well. Or could be because you have organs imbalance, so it doesn't work well. Okay.
Mhm.
It could be you may feel that it works very well right now, but as you keep going, it keep coming back. The pain keep coming back. So, oh, it doesn't work as well. I mean, the lasting result doesn't win well. So when that happens, then again, it may be because of the structure imbalance is part of the problem, not just the meridian blockage. Okay, and it could be because of the organs out of balance. So you need some more treatment, and therefore that we are here to help you as an acupuncturist and Chinese medicine herbalist. We can give you some herbs. We can give you acupuncture for the structural problem to speed up the healing process, so that your lower back pain, once you get results, the results will last longer. And then eventually you don't need any treatment. You don't need to rub it here and you'll be fine. Does it make sense?
Yes.
Okay, cool. So if you have consistent pain in your lower back and you feel quite often, then I suggest you do at least 3 times daily for acupressure point over here, right? Then also put a heat pack on your lower back, because heat pack can actually help the circulation in the lower back, you know.
Okay.
And with the acupressure point and local heat pack, it I suggest probably 10 to 15 minutes lower back with heat pack. And if like you do it once in the morning, once in the afternoon, once at night time, and between that, if you feel pain and the pain level is quite uncomfortable, you're allowed to do an extra one, okay? Because it's very simple. You just sit there and you just do it. If someone's driving you, and you can do it anytime you like, okay? But be in mind, if you do the back 5 points, after that, and you feel pain remain in there, even though you don't do it, or next time when you want to do it, you touch it, oh, you can't touch it. That means you overdo it.
Okay.
That happened all the time for my patient, because I say, well, the harder the better, the longer the better, and they keep rubbing it, and they got bruised, and they can't touch it anymore. And what do? Give it a rest. Put a heat pack over this area,
Yeah.
right? Don't touch it for a while, for probably a couple of days or up to a week, and then you come back to it. And you come back to it, and you can start it again, and start it again, and you can go to the opposite side and deal with the opposite side. Okay, this is very important. I think most newbie, they overdo it.
We'll do it.
Yeah, often. Every time I show my patient, they come back and say, "Oh, so painful, I can't touch it now." I said, "You overdone it." Yeah, all the time.
Mm.
But that may happen to you, even if I tell you right now, it may still happen to you. Just this is how you deal with it. Heat pack on, rest it for a few days, or after a week, or even more, and focus on the other hand. And now, if you focus on the other hand, don't press it too hard. You just need to feel the tenderness spot, and then wrapping for 10 seconds or up to 30 seconds. So if you press it and you can't, if you press it from here to here, and after 10 times you press it from here to here, you can't feel any pain, press it further. So for the start, I only want you to feel it when as soon as you feel the tension, the tendon spot in there, you can press it a little bit more, but not too far, not too deep, because most of the time you press it too deep and you keep wrapping it and you repeat and repeat, you're gonna hurt the point. Okay, right? Any question?
So
Questions?
far as well explained.
Pardon?
So far you well explained, so I understood.
I explained all, so you don't have problem. They
No
don't
more,
have
I
a
understood.
question.
No.
That's good. That's good. That's what I want. Any of you have any question? The
No,
others?
we've got.
We're all good.
Oh, thank you,
Perfect.
Kevin. Thank you. Thank you, Gunda. Let's see the last one over here. All right. For everyone who here today, this is what we offer. I know you suffer from back pain. You definitely hear about back pain. You want to learn something, and I'm glad that I show you that some things may or may not work for you. Then you understand that the structure imbalance there, which means the acupressure point won't help. You need acupuncture, or if there is organs imbalance, and you may need herbs, or you may need acupuncture to help with that. But definitely do your work first, okay, to see how well you can go. But you can also come in for a free quick acupuncture. The free quick acupuncture normally is we call GE structure acupuncture, which is for the structure one. Okay, you can do that, or we can do the organs imbalance. We can do the meridian blockage as well. We need to test it out, which one. We give you a quick diagnosis, and then move toward to the treatment, quick needle in and out, and see how we respond to it. Yeah, something like that, and see whether you respond to acupuncture or not. So any of you in here, you want to take the offer, it's free, totally free. Just want to help out.
Nothing.
Oh, are you good? All right, no problem at all, right? So you can, this is open to everyone, not just you. If any of your friends, family, if they suffer from back pain or any other health issue, the quick acupuncture is mainly for pain relief. So we can do quick acupuncture, and you can just share with them about us, okay? And then if none of you, think that you need the free quick acupuncture today, that's okay. But you're welcome to call us. You can call us on 0800 221 224 or email us and ask for one free quick acupuncture, right? You're welcome to ask anytime. Not today, probably not tomorrow, in the future. And the right's on you, okay? You can ask anytime you like. Right. That's it. That probably not for John. It's too far away. John, once you come to New Zealand, Hamilton, you're welcome to come in for free quick acupuncture. One day. Okay, cool. Thank you very much, everyone.
All good. Thank you.
Have a good
Thank
night.
you.
You
You
too.
too.
Okay, bye-bye.
Bye.
Bye.
Bye bye.
Bye.